we always talk about, all this like menial work and this stuff that, you know, that takes just a lot of time, and I've seen, some physicians out there use ChatGPT to say, hey, here's a patient, here's their information. Well, write up a pre-authorization letter for me so they can get this medicine or test kind of authorized so that I don't have to do it, or I don't have to pay one of my staff to do it. There's stuff like that. There's stuff there where, it would be great for me just to kind of dump all my charts into an AI and say, hey, pull out the quality data and then send it to the insurance company, so that my staff doesn't have to do that, or we don't have to find the right box to check, so we can send it to the insurance company so we can get all this quality data or something like that. That's a lot of the menial work that is just, I mean, all of us here, we're all complaining about, our computer system, our electronic health record. Are there ways where AI can really do the things that the electronic record was supposed to do, save time, and still get us paid?
Yeah, it's funny that you mentioned that. I just used it for the first time myself, just in the last couple of weeks with a jury letter for a patient who's asked to go into jury duty just a couple days before her whatever the deadline is, 70th birthday or something like where you can't do jury duty anymore. And when she first asked me to write the letter, I thought, I'm in the middle of all this stuff going on. I thought, you know what? Let's go to this thing here, and I put it in over there. The create a letter for a patient who can't participate. She couldn't participate for these reasons, and it spit out a letter. And I no kidding, I copy pasted that, put that in a Word doc, sent it to my center manager, and I said, "Hey, can you make this look pretty? Edit it a little bit." And within minutes, she had it done, and it was a done deal. It was off my. So I'm excited. I'm with her. Yeah, I don't know. Has it ever happened before? Where hey, we got to stop this. This is too good. We got to stick with the black and white laser printer. These color laser printers that can scan and do all this. We got to slow that down. We got to embrace it.
Yeah, exactly. I mean, the one thing that we all hear is that, we love seeing patients, but we don't like doing the paperwork and the things to justify what we're doing. And I really see artificial intelligence and things like ChatGPT, they can really address things like time, which is the most important thing. I talk to residents, medical students all the time. They're like, how do you get that work-life balance and all that stuff so you can spend more time with your family instead of in front of your computer? And that's really one of the many potentials I see for AI.
Yeah. I mean, the doctors aren't getting burnt out from medical complexity or anything like that. I mean, that's what we like. We talk about it all the time. We'll meet people and they'll say, well, American doctors are burnt out. The American population is too sick. The average American's age is only 37, 38 years old. We don't get burnt out from seeing, from seeing our patients. It's all these, these trivial tasks, like you said. And yeah, I'm excited with you too. I think that was great.
Yeah, it's the I think I think there's going to be a lot of utility for it to actually suggest diagnosis for patients too, to be sort of running in the background looking for patterns. I know I was talking to an IT person in a previous role with another company that I had, and they came to me and they said, "We've got this great ability to figure out who's going to get readmitted, but you're not going to let us use the tool." And I'm like, well, why? And they said, well, because we can't tell you why it works. They use machine learning. They took a bunch of data, they looked at it, and they actually were about 70% accurate predicting on who's going to get readmitted to the hospital. And I said, well, fortunately for you, you're dealing with a family doctor, and we wind up having to deal with a lot of things that we can't exactly explain how it works. So we'll give it a try and see how it works. But I can see there are a lot of opportunities there that can help us, suggest a diagnosis we should think of, not make the final diagnosis, but a lot of times it's how you put the patterns together to make the diagnosis.
Yeah, exactly. I mean, I've seen a lot of the tech type of arguments that I heard when, when people were starting to really experience initially in social media. social media will take over, doctors, and they'll be out of a job. And, now it's like, oh, AI, they're going to take over, doctors' jobs and things. Now, I mean, a lot of the technology is very impressive. You see what they're doing with all these X-rays and patterns in radiology, and there are some specialties that maybe say, oh, maybe we're maybe a little bit concerned about that. But I think primary care, family medicine, the complexity of it, the interpersonal relationships that we have with our patients. I'm not concerned that AI is going to take over my job. AI is going to help me do my job, do it better, and to save time so I can have more time with my family.
Right. And I mean, we're still, I mean, even if you know exactly the right things to do, how many of our patients do all the things U.S. Preventive Services Task Force recommends? They're up to date on all their immunizations and all their screenings. They still, it takes some influence. It takes some leadership to help them make the decisions for them. And it's still their decision, but I think a lot of times they like to talk through it, and maybe someday AI gets to be a completely sentient being and can have these conversations. But there's something about the long term relationship that makes a huge difference with patients.
Especially like what he said with all the misinformation. That's what that's what we're there for. When somebody's feeling a little flippant or resistant to whatever recommendation, we're the doctor that they, oh, you know what, I saw this thing online, and or like you're the trusted person, the family doctor.
Yeah, exactly, exactly. I'm very passionate about technology, but I'm also, really passionate, as both of you are. That primary care, that family medicine. We are. I think we're the leaders in the nation. I think we're the advocates for our patients. Especially when it comes to relating to their different specialists and all that. But when it comes to technology, I think primary care, family medicine. I think we're really and I see a lot of my colleagues, they're embracing this leadership role that we have in our communities, with our patients. So I'm really passionate, about, you know, uh, uh, family medicine physicians, primary care physicians being leaders in their community, and also in the healthcare space.
So you practice in the same county as East Palestine, Ohio, right, where the big train accident was that released the chemicals. And there's a lot of discussion about how primary care interfaces with public health or is part of public health. What I'm sure that when that happened, that wasn't anything that you had been planning on. What were we going to do when there was a chemical spill in our local area? But how did that impact your practice and your patients?
So East Palestine, Ohio, they're about maybe 20, 30 miles from our practice here, from our town here. So we didn't really have any kind of, direct involvement with some of that, the care there, but we have a lot of patients in that area. And, they called us, and they say, hey, this is what's happening. And we're having these symptoms. Is, hey, come on in. We'll talk with you and see what your symptoms are. I'll review your chart. We'll see if there's any kind of testing that we need to do. I had a lot of my friends and colleagues in that East Palestine area really on the ground, interacting and talking with public health, talking with the state public health department. And a lot of those were primary care docs, because they know the community, they know their patients. And I got some questions about that. Yeah, I mean, I can't believe it's been a few months. But unfortunately, with this type of thing, we may not even see what really the effects are 10, 20 plus years down the road. But hey, I'm still going to be here. But when all the press is gone, when all the politicians are gone, when all the things are gone there, that the primary care docs are going to be around to take care of our patients. And it was a really crazy time locally here. Just the local news, obviously, which is focused on this, focused on the people, focused on outreach, trying to get those patients and people in the community resources. Unfortunately, I still have patients out in that area, they're even afraid to go in their house or stay in their house, which I really understand. Some of them are really at that site where the train derailment happened. And hopefully it can stay in the news. The state authorities and national authorities can kind of still pay attention to that and take care of those patients. It's just a tragic, sad situation.